Is that Pokemon? Who's this? Is this yours?
Angel was born with a mole, or what's medically called a congenital nevus. It covered half his body. It also put him at high risk for malignant melanoma.
The traditional treatment was to excise all of these and replace them with skin grafts, which has not yielded very good results. I had some experience with skin expanders from a variety of applications, including breast reconstruction. And
plastic surgeon Dr. Samimi frequently uses tissue expansion for breast reconstruction for women who've had mastectomies. Angel's condition is rare and not easy to treat, but this technique should help him look better and shouldn't hurt as much.
The old way of treating these was to completely remove all this here and take skin grafts from himself and replace the skin with skin grafts, which led to significant scarring and significant contractures around areas of joints, because the skin graft never has the same thickness as his own skin. Plus, the areas where the skin graft come from can cause quite a bit of scarring and have a not nice cosmetic appearance. And it's a lot more painful than this process here.
How it works: a balloon-like device is surgically placed under the skin.
This is a silicone shell with an attached tubing and a port. This implant is placed underneath the skin, sometimes underneath muscle. The port is placed underneath the skin also, and then in weekly intervals the patient comes in and a needle is inserted through the skin into this port, and salt water, saline, is injected. We inject as much as the patient can tolerate in each session, and for example this one holds about 200 cc's, and we could place about 30 or 40 cc's in each session.
Dr. Samimi says since he first began the tissue expansion on Angel 2 years ago, more than half of the mole has been removed.
Angel. This shows a side view of the expander that's fully expanded here. And as you see, the baby was still fairly small then, but was unable to lay on his back during that period. Another view here with the expander fully expanded. We actually had moved the skin down to cover the area.
The idea for tissue expansion comes from pregnant women and how their skin stretches.
Pregnancy is a great tissue expander. Also other areas where patients would, or people would develop rapidly enlarging tumors that led to stretching of the skin stirred interest in this process. Also native cultures, African cultures, women used to stretch the skin of the neck or the lips because it was a beauty sign, and those were probably the first experiments or the first experiences in tissue expansion.
And the stretched skin offers a near-perfect match of color and texture.
The main conceptual difference between a skin graft and tissue expansion is that a skin graft really only transfers skin, while a tissue expander can stretch any tissue, including skin, subcutaneous fat, muscle, even nerves have been stretched with this technique to be lengthened and to be transferred.
It will never completely replace skin grafting, but Dr. Samimi says it's successfully used for repairing scars from burns, and it's also very popular in breast reconstruction.
Most commonly at the time of the initial mastectomy underneath the muscle and the skin, and then 3 weeks out the patient comes in and we use a special device, which is this one here, which will locate the port, because I cannot feel this, underneath the skin, and the arrows will light up. There we go. There. And then I mark the location on the skin, and I insert a needle through the skin into this port and gradually fill this one here. This is meant to be eventually replaced with a permanent implant, which I have a small one here, a silicone implant, which we're another operation.
It will be several years before Angel's treatment's completed. Still been a lifesaver for his rare condition. And Dr. Samimi says we're just beginning to see other applications for its use in the future.
We have used it in reconstruction of even muscle tissue and reconstruction of the abdominal wall to create tissues that are otherwise really only replaceable with artificial materials which carry a